Welcome to Premier Pain Talk, a podcast dedicated to expanding awareness about treatment options for people in pain. Each week, host Dr. Michael Danko from the Premier Pain Treatment Institute in Cincinnati, Ohio, will discuss cutting-edge treatments for pain management that are improving the quality of life for those suffering from chronic pain. Tune in now to learn more about how to relieve pain and restore your life.
Hello and welcome to a new episode of Premier Pain Talk. I'm your host, Dr. Michael Danko. With me today, I have two great providers from our practice, Premier Pain Treatment Institute. I have Lindsay Link, who's going to be the star of today's episode, and April Egbert, who's going to be my co-host on this one. We have 4 locations in the Cincinnati area for chronic pain management. We have our Loveland, Ohio office, our Mount Orab, Ohio office, Hillsborough, Ohio, and Middletown, Ohio. All of them in Ohio, all of them in the Cincinnati area. And today we're going to be highlighting Lindsay because she's the newest member. But one of the things with joining our practice is I think there's some expectations you have with the new job, and there's also things that you just are totally unexpected. And so, given that interventional pain management is a specialty that's maybe not as broad and well versed as something like primary care or internal medicine or orthopedic surgery or cardiology or some of those. We're a little more specialized, and there's not as many of us out there. So I think that providers sometimes don't have as much of a breadth of experience coming in, and sometimes what they expect and what reality is can be a little different. And I thought that might make a fun episode. So rather than letting me hog the whole episode here, I'm going to kick it over to Lindsay, let her introduce herself and tell us a bit about her background and what brought her to pain management.
Yeah, so as is typical for me, I don't do anything the easy way. I knew when I was younger that I wanted to be in healthcare, be in medicine somehow, but delayed that by a couple decades by, trying everything from, I was a music major, I was in sales, I was in fraud management or, fraud analysis. And then in 2016, I was like, you know what? Done with this. Time to do what I've always wanted to do. So got my prereqs for PA school, and I went to EMT school at Cincinnati State and finished all the fun stuff like Gen Chem, Biochem, Organic Chem, and everything for PA school at NKU. And then PA school at Mount St. Joe, where for those who aren't familiar with PA school, you do a certain number of rotations. Most of them are part of the national curriculum, and then you get to do 2 electives. So, and then also I just completely glazed over the fact I was a medical assistant in hematology and oncology. Being a volunteer EMT and a medical assistant, that's how I gained my clinical hours. But yeah, it was kind of but I knew in my heart at some point this is where I would land. So thankfully I did. It was a long road to get there, but eventually I got where I wanted to be.
April, I'm gonna ask one more question, then I'll let her fire an over.
Okay.
But did you do any rotations in pain management when you're in PA school?
Sorry. I thought you said April. I was waiting for her to answer. No, I did not. Closest I got was
I could answer. I didn't either. So pain management was not something that was brought up in nurse practitioner school. I didn't have a strong ortho background, a strong spine. So going into pain management for me as well was probably just as new to you as it was to me 8 years ago. So I have a question. So you being new to pain management, what would you say your top 3 maybe top 3 goals that you had set for yourself when you walked into day 1 of here's my first day at Premier Pain Treatment Institute? What were some goals that you had or that you set for yourself as a new grad?
Well, time management obviously is a huge thing. Kind of when you walk in and you actually see what a day is like. I think my first day I came home and just stared at the wall for a while, like, oh my gosh, how does one do all this in one day? So I knew that had to be, something to tackle and an ongoing issue, of course, for most people in healthcare. Another was, I would say, taking the pressure off of yourself to fix a problem, because if you're in any derivation of healthcare that deals with a chronic condition, odds are you're not going to really quote unquote fix anything, and taking that pressure off of yourself. And I guess just trying to think ahead without overthinking, which is another one of my chronic problems is overthinking. So I think that those are things that kind of hit me right off the bat with like things that I'm going to have to really focus on and will take some time, but need that are worthy of that focus and attention and probably won't be fixed very quickly.
Yeah. And so, facing when you have a condition that's you're seeing the patient that's chronic, a lot of times they will also have other kind of conditions that develop. So they might kind of start coming to us with back pain, but then as they've been compensating for their back a long time and their knee starts bothering them and their hips bothering them on the other side. And, how have you seen it with the complexity of the patients? Has that been a little bit of a surprise for you? And when you're in the room with them, how do you try to prioritize and, get through the visit without having to take up, half your day?
That is very true. So, especially if you see a new patient, it's well, and then this and this and this and this, and you're okay trying to, make sure you have all the information and all the relevant information, but also knowing that you have to kind of start somewhere. And, given the time, most folks can come up with a bunch of things that they would like to improve about their themselves or their pain or whatever the situation might be. But it truly has been, I know April has said this to me and other providers that I've talked to have said this to me. It's like, okay, well, you said 3 or 4 things. Take your finger, put your finger on the spot. That is, if you could get rid of anything, any one of the things that you've talked about, which would be the most impactful to you. And just, you got to pick a place to start. And so I have actually said to whether it's new patients or patients that have been with us for a while, but it seems like things are starting to get either you feel inundated trying to figure out which way to go or whatever. I'll say pain management is an oven, not a light switch. It's going to kind of take some time to perhaps get where we need to be. It's not necessarily a here we go and that's taken care of, and that way they have the understanding and the expectation that we can't necessarily do it all and then move on. They have to understand that whether it is trying to get to the right therapeutic level of a medication or trying and failing certain things, that just because it's not one size fits all, letting them know up front as soon as you can that it takes time. And then they know that we can't necessarily tackle every issue all at once, and that takes that burden off of you as well as a provider.
How has your support been while at Premier Pain? So I remember, when I first met you doing your interview, and I know that can be just as intense as coming in on your first day of work, but how would you say your support is? I know, Dr. Danko has said that we have 4 offices. We have a surgery center. There are 7 or 8 APPs. You have 3 physicians. So, how has that support been for you, knowing that, while you work in this one office, you've got, all your peers are in, spread out, in between all the offices. How has that been for you to be able to know that you're not just by yourself, so to speak?
Yeah. I am amazed by the fact that, you think about how things might have been not even that long ago. If you need advice, if you need, a second pair of eyes, if you need something approved, if you need, whatever the case may be, I will be working with the patient, talking to them about, okay, well, I think we might do X, Y, and Z. And in my head, I'm thinking, oh gosh, I don't know. And I'm on Teams. As busy as all of us are, whether it's for, either a pain pump increase or this medication or this dosage, I'm not sure which way to go. Everyone is at your fingertips, literally, or can make a polite excuse to leave the exam room and say, hey, could you take a look at this? What would you do? Pardon me. And it's right there. So even though we have our little islands of offices, everyone is working together basically all the time. So you're never without someone who, well, and me being as new as I am, everyone's more seasoned than I am, but you're never without a more seasoned ear or pair of eyes to help, with anything you need. So I am immensely grateful that we don't have to wait to get someone on the phone or have something done by paper, God forbid, or things
Yeah.
like that. So you have everyone kind of working with the patients at any given point if need be.
Mm-hmm.
That's it. And if you kind of funny because given the how fast time flies, I think you've been with seeing patients in our practice and working with us for 7 or 8 months already. So as time has flown by and as you've got a chance to see some of these patients and have the procedures that have been done for them and see how their outcomes have been, um, you know. Is there a favorite procedure or two that you've seen come through so far where you're like, yeah, that seems to really work, and it's not something I really thought about ever offering to patients? Or, I think one of the things as a medical provider, you'll gravitate towards what you perceive is going to be the best for your patients. So just curious if there's a procedure or two that you've particularly taken to as you've been, seeing patients for the last 7 or 8 months or so.
Yeah, I get really excited about, I know, well, obviously I get excited when anything is beneficial to a patient, but I've told patients before that if I were on their side of the, exam room, that if I were a candidate for nerve blocks and an ablation or mild, those are two that I tend to kind of get, enthusiastic about in particular, because as, this has come up recently in conversations, but the fact that you can take action on an item or on an issue with mild. So there's a specific ligament that is the culprit, right? And if that's identified in imaging, then you can reduce that ligament to help free up space. And then that's going to have a direct effect. It's certainly, before I started working there, not something I had heard of. But if I see ligamentum flavum hypertrophy on an MRI, I'm like, oh my gosh, yes, it seems like they're a candidate for mild. And then with ablations, the fact that you can get such a long-term period of relief from these, and they are able to be repeated as necessary, to maintain that. I've always said if I were in your shoes, that is the way that I would go. I think it's fantastic that those are things that are out there. And I always say, these weren't things either weren't around or weren't offered when my mom dealt with the same set of symptoms. And had these been available, I think about how different her life might have been and how much that might have impacted her life. And I try to convey that to patients. These are things that aren't necessarily well known to the common person, but to be able to discuss them and lay these options on the table for a patient is really exciting because, there's hope out there. That's not the OR necessarily for, spine surgery. So yeah, I would say mild and the radiofrequency ablations are two that I get very excited to talk about.
So as a new grad, do you ever get excited, internally and, not exactly in the patient's room, but, it brings a smile to your face when you pick the right treatment and it works and they come back and they're like, Lindsay, I did this procedure that you said would work very well. And I feel much better. I went outside and played, or, I walked to the mailbox for the first time with as very little pain as possible. How exciting do you get? Because I know after 8 years, I still get excited, like, yes, I nailed it. I know you did this patient something, really good, and, talked up a really good treatment for option for this patient. So how does that make you feel as just, a new grad, so to speak?
Oh my gosh. And part of it is because we are dealing with chronic issues, right? So it's not that you sew them up and get them on their way and yeah, they're not bleeding anymore. So, good job, whatever. I do get so excited and my empath comes out that I'll get teary-eyed if they're like, oh my gosh, I just had the other day, he hasn't been able to raise his arm past this point in months. And,
Right.
he's been able to, it that you have helped improve someone's life on a daily basis. And, for things where you treat them and they're out the door, you don't get that sort of, gratification, or that gratifying feeling. So, and I'm sure it will never get old, because how could it? You have someone say, "Oh my gosh, I was able to play with my grandkids," or get out in the garden again, or something like that, and I hadn't been able to. I mean, it's absolutely fantastic.
Mm-hmm.
Yeah.
What? Go. I'm sorry, Danko. Go ahead.
No, finish one
Sorry,
more.
I got. This is a fun episode for me. So, um, what what advice or what learning or education would you want a new person or a new grad to know going into pain management?
I think it would be the extremely helpful because to have experience with the procedures from the jump, because first of all, you have to be able to know enough to recommend them and when. And then inevitably come the questions. Even if you know that, then they're going to ask, um, okay, well, what happens? What's it like? And then they're going to ask, well, I've had this, or you see them for their follow-up, and it's, well, I've had this symptom. Is that normal? Or, asking details about it. So being able to see like from beginning to end what happens, that you might be able to conceive of it or read about it, or, watch videos or something. But, that is immensely helpful, because again, these are things that aren't commonly known. And so if they're not commonly known, they're not commonly known, even if you've had medical training. Because like I said, the closest I had was ortho, and I was lucky enough to do a rotation with a spine surgeon, but that was also spine surgery. That's not the same. So while some of the symptoms and some of the, overall might be similar, you're not getting that interventional pain management flow, or,
Right.
Array of procedures. So I think being able to speak intelligently from the symptoms that get you there, to the indications for the procedure, to what to expect, the day of, et cetera, and after, is immensely helpful in terms of really knowing what to do and when for a patient, especially if they've tried something and it maybe didn't offer the impact that we all would have hoped that it did. Because it's like, okay, well, what's next?
Right.
One of the things that I think is when I think back to my own career, I remember specifically a rotation in medical school. I was rotating with a primary care doctor, and the patient had low back pain, and we were like referring him to physical therapy. And I just remember like specifically thinking like the problem was low back pain. Like this was the diagnosis was low back pain. And now that I like in pain management, and as I've worked through my career, I'm like, well, okay, well, that's great, but that's like saying like the thing you're wearing on your foot is a shoe. And it's just like, okay, tell me about the shoe. And it's like, what shoe? Like which shoe? What brand? What kind of shoelaces? They got Velcro. It's like in pain management, like low back pain is not just low back pain. It's not the destination. It's really the beginning of figuring out what is the cause. So is it the SI joint? Is it a herniated disc? Is it radiculopathy? Is it spinal stenosis and they got ligamentum flavum hypertrophy and they need the mild procedure? Is it, facet arthritis and they need a facet ablation? And this is some of the things we've talked about. So I think it's been one of the things over my career as I've gotten more and more experience, I've gotten to so much better at figuring out the root cause and then being able to address the root cause. And then really getting more and more of those moments where the patients come back and the treatment you offer really worked. Because that really is, that's why we're in healthcare. We're not in healthcare so people can yell at us and complain to us and tell us how much stuff doesn't work for them. We're in it because we're trying to help them get better and help them function better. And so, yeah, as I move into kind of year 12 of my career, and April, I think is moving into, she's maybe finishing 8, moving into 9, and as you're moving into, month 9 at PPTI, and as you're moving forward, last question I really have for us today is maybe what goals have you set for kind of the next coming, several months or couple of years as you try to see your career progress, and then maybe you can kind of finish it as a two-part answer, and then like what if we forgot to ask you today that you really wanted to take the chance to tell everybody about?
I want to continue to know more about the kind of the lesser known procedures, things that we haven't talked about today specifically. So, we didn't talk necessarily about spinal cord stimulators or Vertiflex, or there are different there, you could go on for days, but to really expand my knowledge of these so that if they've been down the road of, well, I've gotten injections, it didn't work. Okay. If I gotten this, it didn't work. Gotten this, it didn't work. You have to keep thinking. You have to keep your mind open. You have to keep learning. Otherwise, you get complacent, and the patient will pick up on that. That you don't. You kind of got your bag of tricks and you stick with that, and then it's, well, don't know what to tell you. I mean, that you can't do that, right? So I need to ensure that I don't look at a certain number of options, and there we go, and make sure that I remember to keep asking, because it's hard knowing, like, as I said, we're all busy folks, that it's okay to keep asking questions. I'm always afraid I'm bothering people. I know that I'm not, but it's in the back of my head that, oh, I should know that. I should know that. But it's better for all of us if we all keep asking, right? Because there's always going to be that circumstance that someone else has seen that you haven't, or knows a little bit more about, no matter how long you've been in the game. And then I would say, as far as anything that hasn't been covered, I don't really know. I'm cheating and looking at a little list I made for myself. We did kind of happen to cover it, but I would say one of the things that was interesting for me, even though I consider myself an assertive person, but when you're new to this, you do have to learn how to say no, because some people don't want to do physical therapy again, or some people don't want to try a steroid injection again, or some people think that taking more medication or a higher dosage is what's going to help. And being okay with saying, nope, I really don't think that that's appropriate, and offering alternatives and giving the reasons why, is something that you have to, it's a skill, that you have to kind of continue to work on. So I would say that that's the only thing that maybe we didn't touch on, was that, it's you've got to know, you have to be able to validate for the patient, you have to be able to explain your reasons why, if they ask for X, why you would say no to X but offer Y. So that's the only other thing that I would say maybe we didn't touch on, is knowing how to give your reasons and back it up. And that also comes with knowledge and comes with time.
Yeah, that's a fantastic point. I think that's something that is very much an acquired skill. The sometimes the treatment that's best for the patient isn't necessarily what they perceived in their mind was the best for them, and so it takes a little bit of time to explain, and may take a few different visits, or a couple of months or a couple of years, really, for them to be ready. That for every patient, it's the right procedure for the right person at the right time. And so if all three of those don't line up, then the treatment's probably not going to happen, or at least not happen as successfully as you want it to. So I always think it's a bit like raising children. Sometimes what's best for your kids isn't necessarily what they want, and so that same kind of tough love that is a lot easier to do when it's your own children, can be a lot harder when it's another adult who's sitting across the room from you, when you're trying to help them. So that's a fantastic point. And I think we're kind of wrapping up, and April and I think have had a lot of fun beating you up, Lindsay. So you've been a really good sport, and we appreciate it. So this is Dr. Michael Danko, along with two advanced practice providers from my team, April Egbert and Lindsay Link, and we're at Premier Pain Treatment Institute. We're in northern and eastern Cincinnati. We have 4 different locations. You go to our website at www.premierpaintreatment.com. And you can look up, see the map, see where we're located. Our phone number, if you're local and you're trying to book an appointment, is 513-454-7246, or that's 454-PAIN, PAIN. We have rebooted this podcast recently, so this is kind of episode number 3 of our rebirth, so to speak. But if you look on any of your platform podcast, you can probably find our feed and look back at some of the older episodes, some of the things I recorded a couple of years ago before we took a little hiatus. So with that, we're going to sign off, and appreciate you for listening, and hope if you're local in Cincinnati, we get to see you sometime and get to know you and help you with your pain.